When the COVID-19 cases in Hong Kong resurfaced, the Hong Kong government did not address the public outcry to conduct inspections on exempted personnel from China's National Security Council, who were dispatched as a result of the new national security law effective since July 1st. Instead, without an open bid, the Hong Kong government designated several mainland companies to conduct testing on over 7 million people in Hong Kong, although existing Hong Kong companies were fully capable of performing these tests. On July 14th, Hong Kong Chief Executive Carrie and the Executive Council passed an emergency legislation to add or restore certain measures to counter the pandemic resurgence and said that they would introduce 2 mainland Chinese companies to assist in testing certain groups. The Hong Kong government would cover the expense. Carrie did not disclose the specific identities of the 2 companies at the time, but mentioned that one of them was arranged by the Shenzhen municipal government of Guangdong province, while the other has been mainly testing in Macau. She hopes to prioritize 400,000 tests for people in the fields of nursing homes, restaurants, property management, and taxi drivers. The Hong Kong government's explanation for contracting mainland companies rather than opening a bid was that the pandemic was too urgent to allow a normal bidding process to complete. At midnight on July 14th, the Hong Kong Food and Health Bureau announced that there were actually 3 companies participating in this mass testing, namely the Sunrise Diagnostic Center, a unit under BGI, China Inspection Company Limited, and Prenetics. BGI is a private company listed in Shenzhen on record, but in reality, similar to Huawei, it is a company officially supported by the CCP. BGI and the CCP's National Gene Bank are actually the same unit under different brands. BGI opened a Hong Kong R&D center in 2010 in the New Territories. The Sunrise Diagnostic Center, which is designated for COVID testing for Hong Kong residents, is located at the BGI Hong Kong R&D Center. On August 1st, China's National Health Commission announced that at the request of the Hong Kong government, it would dispatch a support team composed of 60 clinical lab technicians from more than 20 hospitals in Guangdong province, selected by the Guangdong Provincial Health Commission. 7 members of the advanced team arrived in Hong Kong on August 2nd. In an exclusive interview with Xinhua News Agency, the leader of the advanced support team, Yu De-wen, said that he would assist Hong Kong with large-scale testing and strive to achieve a daily testing capacity of 200,000. At such capacity, it would take just over a month to test the entire population of Hong Kong of 7.5 million. By August 2nd, the people of Hong Kong found out that the China Inspection Company Limited and Prenetics had been delisted and replaced by KingMed Diagnostics Limited. According to the company's website, KingMed Diagnostics is a medical laboratory with service centers in Hong Kong, Kowloon, and New Territories. It remains to be investigated whether this KingMed Diagnostics has a mainland background and whether it has the necessary testing capacity. According to the results of the 2017 Health Manpower Survey by the Hong Kong Department of Health, 80% of the 3,426 medical lab technicians were employed by the hospital authority. Of the 693 active medical lab technicians who had received or were receiving additional training, 11.4% were in medical microbiology, the profession qualified for COVID testing. There are also 8 universities in Hong Kong, and many professors' laboratories can perform testing. Private companies in Hong Kong would have seized the opportunity to expand their businesses had there been a public bid opening. There are only a few countries in the world currently conducting national testing. Professor Kwok-yung from the Department of Microbiology at the University of Hong Kong advocated a significant increase in Hong Kong's testing capabilities to 7,500 tests per day, but he believed that universal screening is pointless. Dr. Wen-Hui Mao from the Duke University in the United States also told the BBC, national testing needs to be completed in a relatively short period of time to achieve the goal of comprehensive screening. Considering that the reagents also have some false positives, national testing cannot be 100% accurate. There may even be negative effects such as cost, cross-infection, and affecting normal testing and medical treatment. On August 2nd, Gary Fan and Roy Tam, members of the New Democratic League of Hong Kong, protested at the entrance of the Hong Kong Hospital Authority. They questioned the professional qualifications of mainland inspectors, the privacy of citizens' DNA data, and the quality of testing reagents. The CCP authorities once collected DNA samples from the Muslim population in Xinjiang. They worry that China is collecting the DNA of Hong Kong citizens under the name of pandemic control and prevention. As early as a few years ago, it was reported that the CCP is setting up the world's largest DNA database in an attempt to combine individual DNA information with real-time monitoring tools to establish a pervasive centralized state.